joining me today is Dr. Valerie Mukanga. She is a dentist practicing in the Dallas, Texas area, and I'm so happy she's here with me. I'll have her introduce herself and then we'll get started with an exciting topic for today.
Hi, Dr. Loom. Thank you so much for having me today. Such a pleasure, such a pleasure. So anyway, I'm Dr. Valerie Mukanga. I'm a general dentist, and I have my own practice here in Dallas-Fort Worth area, precisely in Arlington, Texas. And the name of the practice is Healing Wings Dental, and really we provide, all sorts of oral treatment, dental care, from preventative to treatment, and that's pretty much what we do.
Awesome. Thank you. Thank you. I know we talk mostly about the nutrition. Are there any other things outside of our diets that you can do to prevent cavities? I know as pediatricians, we've started applying fluoride vanishes in clinic to help prevent it. Are there any other things that you do or do recommend to prevent cavities?
Yes, as far as treatments are concerned, we do recommend sealants, and sealants, we do them a lot on our children population. It's a protective coat that we're going to put on the grooves of the teeth where cavities are likely to begin. And so we put that protective coat on top of those grooves of the teeth and the pits, and that's going to decrease the chance of getting cavities. But beyond that, you know that it's going to be very important, your oral hygiene routine. You have to brush your teeth. You have to make sure that you brush not only the surfaces that you chew on, but all the surfaces of your teeth. So on the inside, close to your tongue, outside, close to your cheek, you want to make sure that you brush those at least twice a day. And when you brush, you want to make sure that you're actually aiming the bristles of your toothbrush at a 45 degrees angle and rotating so that you're removing all the debris that get lodged between your gum and your teeth. Otherwise, you can end up having another sort of disease, which is gum disease, that affects your gum. So that's going to be very important to make sure that you take care of the health of your gum. You want to make sure that you floss at least once a day, because flossing is going to help you in that you're able to remove the debris of food that stay between the teeth, because the bristles of the toothbrush are too thick and they will not get between your teeth. So you want to make sure that you floss, and you want to make sure that you position your floss in a way that it hugs that surface of that tooth, because teeth are not just straight, right? They're curved. So you want to curve your floss so that you're actually removing the food that's even on the side of those contact area. You can use mouthwash as well. That helps. We do recommend fluoridated toothpaste, but you don't want to use too much of it. Just a little bit, especially for children, it's pea size. Don't go and put a whole ribbon. No, it's not that. It's mostly that you're brushing and removing those surfaces. And then, of course, there's the nutrition. That's how you would actually try to decrease the potential of getting cavity. And then the last thing is you want to make sure that you go see a dentist at least twice a year, so that we can keep things in check for you or for your children.
Absolutely. You've heard her. She's provided so many tips. Hope you can take at least one or two of this and apply it and start implementing it so we can prevent cavities. Is there any last thing you want to talk about before we end the session today?
Yes, I came across this parent to whom we said, your child has cavities, they need to brush their teeth or their gums are not healthy. And they're like, did you hear what the doctor said? And it's like, well, mom and dad, you need to be policing your children. You want to make sure that you're checking after them. Some children don't have the manual dexterity to have proper oral hygiene. So you want to make sure that you do help them, okay? If they can't tie their shoes, more than likely they're not able to brush their teeth on their own. So when they're little, you want to make sure that, yes, you can help them. You can allow them to play with the toothbrush, but you definitely want to go either before them or after them so that you make sure that things are properly clean in their mouths.
Absolutely. Thank you. Now that you mentioned that, I have one more question. I had a parent who said when I asked about brushing teeth, she's like, oh, they fight me. So I got an electric toothbrush and I think that's doing better. What's your take on the electric toothbrush for kids?
I think that it's fantastic. Having an electric toothbrush for the child is very good because, especially because some of them have timers. In fact, there's somebody that came from Sonicare yesterday in the office to present their product, and they have these toothbrushes that have apps where there's like a little cartoon character, and while the child is brushing their teeth, they see which tooth on the character is actually being brushed, and then when they're done, there's like they can get trophies and such. So yes, it does help because a lot of these brushes, they do have timer, but also they're doing the job for a child that doesn't have the manual dexterity to do a good job. And yeah, so it helps a lot. And some of them, I would say, they play music, so
Yes.
it's entertaining, right, for the children. So definitely, if
Yeah.
you can get hold an electric toothbrush, for sure, it's recommended.
Yes, I love them too, and I use it for my daughter. And hers plays music for a certain amount of time. So the timer is the music, where she
Right.
knows when she's done with brushing because the music stops. So there are options to help, and it gets them engaged. Where, well, now I want to brush my teeth because I want to listen to the music, or it's more like a fun activity rather than you dragging and holding them down. Okay, we got to brush your teeth without really getting into the corners. Yes.
Right.
Well,
Right.
thank you. Thank you for joining me today. As always, I am grateful for you all listening. Until next time, I'm Dr. Loom. Thank you, Dr. Valerie.
Oh, thank you for having me.